Well, I grew up in Austin, Texas. I was born and raised there, spent 22 years in Austin, went to the University of Texas, and then went to medical school and residency in Dallas, and I've been in Waco ever since. I did my medical school at Southwestern Medical School in Dallas, and then did 6 years of urology residency at Parkland Hospital. My uncle was a veterinarian, and I assisted him. I worked for him in the summers and helped him on surgeries, and realized very early on that I enjoyed it and was very adept at it, but I wanted to work on people instead of animals. And so from as long as I can remember back, 12, 13, I was going to be a surgeon. I actually picked urology because I was thinking about doing a pediatric surgery specialty. I wanted to do surgery on children. So I was looking at all the different specialties that had dedicated pediatric branches. And urology was one of them, along with pediatric heart surgery and pediatric neurosurgery and so forth. And out of all of them, I just liked pediatric urology the most. When I went to residency, you had to do the adult version first, and so I had to do 6 years of adult before you could do your pediatric specialization. And about midway through, I realized I'm here because I was going to do something else, but I love what I'm doing, and I get to take care of children still, so I'm getting to do some of my pediatric work while at the same time doing the other things we get to do in urology. So it really was an accident. I do see a fair number of pediatric patients in the office. The majority of them are for pretty straightforward pediatric urology problems, and we have some doctors in the state that I'm friends with that are great referral people for me if I have something complex. But we've operated on children as young as 1 month old here, so we do the whole range of ages. At the time I was in training, I liked working with children. I really enjoyed it. The more I did it, the more I developed an affinity for it. That wasn't really because I preferred kids over adults as much as I just enjoyed it. And the pediatric urology surgery rotation, there's a lot of really neat, intricate reconstruction surgery. Same with pediatric cardiothoracic surgery. So it was partly appealing to my desire to work with kids and partly appealing to my desire from a technical standpoint to do complex reconstructive surgery. And as I got into more adult type stuff in residency, I just realized I kind of liked that whether they were big or small. In the last 2.5 years, I've been doing robotic cancer operations, and that honestly right now is my favorite thing to do, above and beyond everything else, simply because it's so new. I've been doing what I do for 23 years and doing something that now is a completely new technology and a completely new way of doing surgery has kind of rekindled that interest that you have after having done something for so long. I always enjoy dealing with patients. I've got a lot of patients who've seen me for 20 years and are, we're friends, and I enjoy that part of it. But the thing I enjoy the most right now is the robotic surgery. My favorite thing to work with is prostate cancer. It's such a complex topic right now, and patients are getting so much misinformation on the topic. And I obviously am an expert in that, and I enjoy helping them understand and make their way through the morass of information and the media telling them either not to screen for it or not to treat for it. I enjoy educating them and reassuring them that they don't need to test for it or treat for it in certain cases, and in other cases they do. So prostate cancer is clearly the thing I enjoy the most, and it's a very large part of my practice. I've been at Central Texas Urology specifically for 17 years, been in Waco for 17 years. Before that I was in Dallas, and actually have a few patients that now see me here from my time in residency up there. So it's hard to believe we've been here 17 years, but we have. I'm married to Michelle. We've been married now for 21 years, been together 26 years. My children, Lauren and Drew, 17 and 15. Lauren's a varsity cheerleader and about to head off to college, and my son's a football player and baseball player. We are outdoorsy people. We've been on 4 ski trips this year, and we do a lot of water skiing and wakeboarding and golfing and pretty much anything to keep us off the Xbox and keep us out of the house. Hobbies are pretty much anything sporting that you can think of. We're probably either doing it or have the gear in the garage and have done it before.